Hi folks, and welcome back. We're going to talk about how sepsis goes to septic shock. Well, wait a second. Sepsis, septic shock, isn't it the same thing? No, it is not. Sepsis and septic shock are different things. Sepsis is when infection gets into your bloodstream and you go septic or have sepsis. Septic shock is the result of having the infection in your bloodstream. So now I'm going to talk to you about how sepsis turns into septic shock. So I have a diagram here for you just to kind of review sepsis with you. The body's invaded by the pathogen here, and then you have an immune response. And so what do I mean by that? Well, whenever there's any type of invader in our body, our beautiful immune system says, no way, man. Hit the road. So it's triggered. Our immune system is triggered, and therefore we have these white blood cells that come in to kill the beast, kill the beast. We release things like interferons, such as histamine, interleukins that say, send some more blood flow down here, raise my temperature. All of those things happen. But what we have to know, which is very, very important, is when the invader comes to a specific area of the body, and when those backup army comes to help, the cell membrane is more permeable so they can get in and out of the vessel to attack where they need to attack. So that's what happens there. And then we get these inflammatory mediators. So what I mean by inflammatory mediators is inflammation. Anytime you have inflammation, you're going to have increased fluid volume. That's why when you hurt your ankle or you hurt your knee, like we discussed previously, or have some type of injury to your knee, then you get swelling there and you get heat there because you have an increased flow, blood flow, and then you have more volume of fluid leaking out or going where it needs to go to attack what it needs to attack. Then you have that decreased flow to your organs. Why do you have a decreased flow to your organs? Well, because it's shunting. That shunting shunts blood to other vital organs like our heart and our brain. And so when we have shunting, then our kidneys start to die and stop making urine. And we know that urine gets out waste products and also helps get rid of potassium that causes our pH to drop. So that happens as well. And then we go into metabolic acidosis. So with metabolic acidosis is really what kills our patients because the pH drops so low that it's not an environment where the body can sustain its functions. So that's what happens. You go into multiple organ failure, and when I say multiple organ failure, our heart usually goes into a cardiac arrhythmia, and you have respiratory, cardiovascular collapse and respiratory distress, and that's when you die. So the difference between sepsis and septic shock is this. Sepsis is when infection gets into your blood from a localized area now into your blood. We talked about the knee earlier. There was a purposeful intervention on the knee called surgery. It knows that there was trauma. So it's going to have that immune response. It's going to have that inflammatory response. White blood cells and things in our immune system come to help fight. And then with that, we have increased membrane permeability. And the increased membrane permeability makes it leaky. So the volume that was inside the vessel is now outside of the vessel. If it's in all of your vessels and it's leaking out throughout your whole body and not staying in your vessels, how do you not have enough volume supply inside that vessel? That is shock. Because remember, the definition of shock caused by not enough fluid volume is not enough oxygen supply to meet the oxygen demand, because the oxygen that is in the blood is now third space all out into your body and not into the vessel. That's where the sepsis turns to septic shock. Thanks for watching, folks. It was wonderful spending time with you. Have a wonderful day and take care.